Okay, welcome to another Zoom call. Hopefully it's a beautiful day in your area as well. Just a reminder to look at the member site for any new information and news, and that all the courses are available to you. Let's jump right in with questions. Dear Dr. Connors, is it okay to put the 6 drops of biocidin? So this is a biocidin liquid in a little water instead of straight because my husband says it burns. Also wanted to know your thoughts about, I think she meant diatomaceous earth for cancer or candida. Uh, Thank you. Yeah, you can use the biocidin in water. That's just fine. So if you need to water it down or put it in your drink for him, that's just fine. So that's good. Diatomaceous earth, that can be good for things in your gut. I would just suggest that you go slow. A lot of things online, you'll hear that you're taking a tablespoon of diatomaceous earth a day. Don't ever start with that. Start with a half a teaspoon and work your way up. So just start whenever you're starting a new supplement, something like that. That isn't really technically a supplement. It's trying to bind stuff in the gut, help kill some parasites in the gut and things that you want to just start slow. And then that'd be something that I would not take, you know, constantly. It's not something you take on a daily basis for the rest of your life. You take that for a period of time and you go off of it for a period of time. So yes, it's okay to put the biocidin in water or in your drink. Diatomaceous earth is fine. It's not really a cancer killer, but it helps kill some things in the gut. But you just start with a low dose. What's the difference between the clear hist or natural clear hist and the clear histamine scavenger? So, when you're dealing with histamine issues, you have to experiment a little bit with supplements to pull histamines out of your body because um, there's a lot of different nutritional um, anti-inflammatories to help pull histamines. Um, the standards that are out there are the quercetin and some other things. Uh, that's in the clear hist. I think the clear hist has like 4 different ingredients. The histamine scavenger is just a totally different product. It has more types of nutrients in there. Some people do just so much better on the histamine scavenger, and the clear hist doesn't do anything for them. And some people do really well on the clear hist and not the histamine scavenger doesn't do anything for them. So you just have to experiment. Now, these two are completely different than another product out there called the Hista Clear. So the Hista Clear is uh is completely different. That is a DAO enzyme. So the DAO enzyme is produced in your tissues through the HNMT gene, and it's produced in your gut through the DAO gene. And defects in either one of those genes is going to produce less of that. So the DAO enzyme is what clears histamine, what breaks down histamine in your tissues and in the gut. Well, you can take the DAO enzyme straight. That's what HistaClear is. It's kind of expensive. It comes to like $1 a pill, but it doesn't absorb. So it'll only work in the gut. So if your problem is a lot of histamine in the gut, or you have huge histamine problems because of dietary histamines, then you use HistaClear when you're eating foods or when you're trying to calm down the inflammation in the gut. HistaClear will not pull histamines out of the tissues. So clear hist, natural clear hist, it's also, and clear histamine scavenger pulls histamine out of the tissues. Those are just different types of products that you're going to have to experiment with. So give them a try. If you've been using the Clear Hist and it's like, oh, it's not really working, just try the histamine scavenger and see if that works better for you. Also, I'm on a low or no histamine diet. Should I be taking the Alovia Immune Aloe supplement? I think it is a histamine inducer, but I'm not sure. No, the Alovia Immune is not a histamine inducer, so you're fine taking that supplement. So there's no negatives about taking the Alovia Immune. It's not going to produce any more histamine. What will produce histamine in the gut is food sensitivities. So what will produce histamine? So histamine is an initial immune inducer when there is some antigen that's present. So if there's an antigen that's present, your body will make histamine. So let's say pollen in the air, you breathe it in, it's irritating the tissue, it's inducing what's called a cytokine reaction, and it's going to produce a histamine reaction. Then histamine and these inducible, what are called immune inducible cytokines, stimulate an immune response against that pathogen. Well, of course, pollen can't be killed, so you just produce histamine. Now, normal people, I don't react to the pollen in the air because they don't have issues with it, mainly because of genetic reasons. So people that have asthma have typically a lot of HNMT defects and other histamine clearing gene defects. You've seen a lot of them on your genetic profile. So people that have a lot of defects in that, they don't clear histamine like someone who doesn't have those defects, and then they don't have issues with pollen and such. So they need to support that somehow. Now, from a medical standpoint, they're just on an antihistamine drug. But if you're trying to stay away from antihistamine drugs and their side effects, you're taking these types of products. So these are the Clear Hist and the histamine scavenger. Now, if you're getting a lot of inflammation in the gut with things that you're eating, then you use the HistaClear. But you don't just jump to that too. We want to find out why. Is there something that's inducing histamine in the gut? And almost always in the gut, the things that will induce histamines are if you have antibodies to different food proteins or peptides, parts of proteins. So you have antibodies to food peptides and proteins. Every time you eat that thing, you're going to produce this histamine reaction, this inflammatory reaction. You end up with this huge inflammatory gut issue. It also affects your brain the same way. So testing food antibodies can be helpful. And how would you test that? You test that with Cyrex testing. And there's a whole bunch of information on Cyrex 2, Cyrex 3X, and Cyrex 10. That's Cyrex Array 2, 3X, and 10. A whole bunch of information on that in the chronic disease and autoimmune course. So if you're having those kind of gut issues, it's good to test for that. Remember, when I'm testing you for food, I'm testing only for cancer drivers. I'm not testing for food sensitivities. The only way to test for food sensitivities is to do a blood test to see if you have antibodies to different food peptides. Dear Dr. Connors, I have not been giving my husband the fenbendazole for a while since he eliminated the shakes, so I decided to put it in his formula with the rest of the items. However, I have been giving it every day for the last week. Should I continue every day till retesting or do 3 days on, 4 days off? I would give it a break, maybe go 5 days on and go off the weekends. That would keep it simple for you. And then we can recheck. I'd also want to know how he's doing with other objective and subjective findings too. Thank you for my Candida return. Would apple cider vinegar help on a daily basis? So I know apple cider vinegar is a hot thing to take in the nutritional world for gut because it's acidic and it helps your stomach acid pH balance. But to me, I've said this lots of different times. To me, it just makes absolutely no sense. The acid that is in um, apple cider vinegar is acetic acid. The acid that's in your stomach is hydrochloric acid. Why don't you just take hydrochloric acid tablets? It's far less expensive than buying a bottle of apple cider vinegar and taking a tablespoon of that with your food. So it's, to me, taking, a bottle of, HCl is far less expensive, and you're getting the correct type of acid that your stomach actually produces. So the reason why you take apple cider vinegar is to increase the acidity of your stomach to help with digestion, because our stomachs can become very pH alkaline. And this is another reason why you wouldn't use alkaline water. Um, because your pH of your stomach has to be about 2.0 to 2.5, and you're alkalizing your stomach acid, so you're decreasing your stomach's ability to digest food, which makes absolutely no sense to me whatsoever. So some of the gimmicks that you hear in the natural world are truly wrong physiology. So to me, it just is, you got to balance it out with wisdom and knowledge and physiology, and it has to me, these things have to make sense that way. So, and apple cider vinegar makes sense because you're adding an acid to your gut, but it's not the same acid as your stomach. It will help a person, but to me, why spend the extra money on apple cider vinegar? Why don't you just do HCl? Are you familiar with the two feathers healing formula? Yes, the two feathers healing formula. Um, I I had some a long time ago. I don't have any now to my knowledge. It's very similar to the black salve. It's a topical formula. And yeah, it can be really great. We've had multiple patients that have used it with success. Watching Thomas Siegfried's video on YouTube, he has proof that cancer is not a genetic disease. Well, he doesn't have the proof that cancer is not a genetic disease. It's been known forever that cancer is not a genetic disease. Now, understand there are some genetic components to certain types of cancer. So, but so for instance, anybody here has had colon cancer? Most likely you've been screened for this certain gene. Well, maybe not if you have no history of colon cancer in your family, but if you have a history of colon cancer in your family, I'll guarantee you they screen you for this gene, because there can be a genetic predisposition to colon cancer with a certain type of gene. We have a couple patients that have that. So yeah, cancer is not a genetic disease. It is an acquired disease, and it's environmental. He wrote the book on as Cancer as a Metabolic Disease. And I read that book that came out, I don't know, 5, 7, 8, 10 years ago. He's not a doctor, but his studies suggest that cancer is fed by glucose. Well, the only thing I didn't like about his book is that he's not a practicing physician. So, matter of fact, his whole idea to starve cancer was everybody with cancer should go on a ketogenic diet. And he had one patient example in the book who actually had smoldering um, uh, um, uh, blood cancer, not a heart cancer. So it was not even a good example for a ketogenic diet, and this person did well and stayed in remission on a ketogenic diet. Now, so the reason what I write about is that every cancer is different and every person's different. So he makes these dogmatic statements that I didn't like in his book. I mean, there's things to learn from everybody. So I do try to glean the truth out of everything that's out there. And he had a lot of good studies and he had a lot of good work in his book. So I'm not knocking his book. But then when you take it to the point that every single person with cancer should be on a ketogenic diet, and it's always this, and this is what it is, then it starts to go, it's just a little fishy. It's like every person, if somebody got helped with chemo, then every single person should be on chemo. That just doesn't make any sense. Every human being is different. So that's why we test for, was your cancer mainly driven by glucose? Is your cancer mainly driven by glutamine? That's why we do test that one HIF1A gene, because if you have that gene defect, you have a much greater chance of your cancer being driven by glucose and doing a ketogenic diet or a keto-like diet, or um, restricted fasting or restricted eating, modified fasting can be really good for you. So that's why we test the specific foods. You endorsed 2 saunas. Which one would you recommend? Here's another one that was recommended on Amazon, and this is much less expensive. So this sauna is, I looked it up on Amazon. It's like $560 or something like that. I don't know. I can't vouch for that sauna. I have one of the 2 that we sell on our site. I really like it. What I've heard from other people having these less expensive saunas is that they take longer to heat up. Now, if that's not an issue for you, and you can zip up your sauna and sit there longer, or you can turn it on and unzip it and climb in, well, you're going to lose most of the heat. The time you zip it up, it's going to take longer, most likely. Now, I personally do not buy all the hype about whether it's an far infrared sauna, near infrared sauna, or it's using far and near infrared. And the reason why I don't buy that hype with any of the saunas that are on the market, is because none of them are true far infrared. So we have that infrared heating device that's called hyperthermia, and we have that for sale in our store. And there's probably a dozen of our patients that have it. Maybe some of you that are on this call have our far infrared hyperthermia machine. Now, there's a reason why it's $5,000, and the plate is only about 6 by 10 inches around that, because that's how much it costs to make a true far infrared device. These saunas that are sold for $1,000, even these wooden ones that you're just paying for the wood, that are sold for $5,000, and they say they have a infrared heating device, and then they show a picture and it's red. The amount of true infrared that's coming off of there is minuscule. So they're using the studies that are out there on something like our hyperthermia machine and equating that to, well, because they have 1% true infrared coming out of their sauna apparatus, is that it's a true infrared sauna. Well, it's just not. There's just not legal standards to this. So really, I've said, forever, that the real purpose of the sauna is to get you to sweat. So if the $560 sauna can get you to sweat, it's accomplishing its purpose. So by all means, I would go for the less expensive one. The only thing that you have to be careful of is that you just have to know that it might take 20 minutes to heat up, and you just have to be okay with that. So that's all I've heard from other people that have used less expensive saunas. And you have to be able to sweat. If your sauna is not getting you to sweat, it's not accomplishing its purpose. The whole idea of the sauna is to get you to sweat so that you're detoxing through your pores and taking some pressure off of your liver detox pathways. That's the whole idea of the sauna. Now, these sauna companies will give you all this hype about far infrared, near infrared, mixed infrared, all this stuff. It's a bunch of baloney, because there's really, truly not enough infrared in any of these saunas to give you any health benefits that they're claiming off the infrared piece. So just know that. Reviewing my most recent blood lab results and aware that I do coffee enemas, my VA oncologist was concerned about the low calcium and low sodium levels and stated that coffee enemas can cause electrolyte disturbances. Well, in all due respect, she's wrong. Coffee enemas are not going to cause electrolyte disturbances. If you had chronic diarrhea, you could have electrolyte disturbances. but not doing the coffee enemas. So that's not it. Now, your low calcium and low sodium levels can be easily corrected by adding some calcium and sodium. It's really the concern with a cancer patient is elevated calcium. So when I saw your blood work with low calcium, it's like, I ain't worried about that. It's the elevated calcium that you worry about with cancer, because elevated calcium is suggestive of metastatic destructive disease, so metastasis to bone with bony destruction. So when you have low calcium, I'm not so concerned about that. You could easily a supplement for that. So the benefits of coffee enemas, even if they were disturbing your electrolytes, it's pretty easy to take some electrolytes. The other benefits to the coffee enemas is stimulating your parasympathetics far outright way, even if this person was correct about his electrolyte disturbance. I'm wondering about some random symptoms and whether they could be related and pointing to systematic secondary infection or imbalance. On last week's Zoom, I inquired about red streaks, first noticed in January 2023 on my legs and torso that come and go, lasting only a few hours at a time. You mentioned the possibility of Lyme disease. I have not gone through your Lyme course, but by symptoms and photos online, it doesn't match well. A description of lymphangitis, which can be true too. You can have inflammation of different things too, kind of fit. So that may be true. So a good diagnostic picture of that would be helpful. Though I have no open wounds, streaks tend to go toward away from my groin and armpits. I do have swollen lymph nodes also. So swollen lymph nodes also could talk about possibility of infection as well. Also in the last week, I've had trouble with urination, with urgency of urination. There's not the pressure of a full-blown UTI, but my first need to go is desperate. I would want to know, I don't know who it is that asked this question. I'd want to know your age. As we age, you might have had a history of, UTIs once or twice or 5 times in the past. As we age, we tend to lose a lot of those symptoms of UTI. And the only symptom that we have is urgency. And then as we get a little older, we can almost get a little delirious. And that is your first sign. If you're over 65 and you have you have urgency and a little kind of cloudy thinking, and people are like, are you okay? You have to think of UTI. And many times you won't get any UTI symptoms, even if you have a history of UTI, so you know what those symptoms are. If you have a first need to go and it's desperate, like, oh my gosh, you got to run to the bathroom, pretty good chance you have a UTI. You can, you guys, you can go buy on Amazon a urinary test strip kit, and it comes with like 50 little dipsticks, and you just go pee in a cup and you can test it yourself and see if there's any bacteria in there at least. So that's what they would do in a doctor's office, and they charge you $50. You could buy the whole kit for $50 and it gives you 50 strips. So that's something you can get. You can just buy those on Amazon. Now, if you have a UTI, most likely you will see bacteria in your urine, but you also want to get a CBC. So a complete blood test, a CBC, complete blood count, will give you a white blood cell count, and you'll have a slightly elevated white blood cell if you have an infection as well. Also, if you're thinking you have an infection outside of the urinary tract, you won't see it on a urinary dipstick. Typically, you wouldn't get swollen lymph nodes with a UTI, but anything is possible. If you have any inflammation of your lymph system, of your vasculitis or something like that, that's a concern as well. But you would see that on a CBC. You'll see an elevated white blood cell count. I've been doing coffee enemas every day since December. Could less than tidy enema provoke a UTI? No. So unless you're putting it in the wrong place. So no, that if you should be washing your enema tube out well with just soap and water and rinsing it really good. You'll be fine with that. So it just you're that just wouldn't work that way. And I've had perpetual earache and sore throat since the fall of 2021. Okay, well, we really should. I mean, I don't know if you've had recent blood work or not. Hold on one second, because I just added a test to our Rupa store. And I wanted to get the name of it and tell you. So stick with me. I am searching our Rupa store right now. Why isn't it showing? Might have to do it again. But I just added what's called what I named a simple CBC and CMP, and it's like $50. So it just keeps it less expensive for you to get a simple CBC and a complete metabolic panel for inexpensive. It's not showing on the Rupa store right now, so I have to redo it. I don't think it saved my changes. So it's simple to get that test if your doctor won't do it for you under your insurance. I was diagnosed with Hashimoto's 20 years ago. I have not been very symptomatic since for hair loss, which increased a few years ago. Now, the last week or two, hair loss has become extreme. So things that will flare your Hashimoto. So if you still have antibodies, thyroglobulin antibodies or TPO antibodies, you still have Hashimoto's. Typically, those don't go away. Sometimes they can go into remission and you can be fine for a very long time, and then they can flare up again. What can flare your autoimmune disease? Well, the truth is anything. Anything can flare your autoimmune disease. I have several videos in I think it's sections or module 7 of the autoimmune course is solely on Hashimoto's. It's all the latest information on Hashimoto's. You can look up some videos on there. And I do have some videos on what can flare an autoimmune disease. Latest research the last couple of years, I'll tell you, salt can be a huge flare. So if you're salting your food, iodine can be a huge flare of Hashimoto's. So if you're taking iodine, you want to cut that out. But I have a list of a whole bunch. I mean, literally, anything can flare your autoimmune disease. Might any of these be related or pointing to an infection? I would definitely get a CBC to make sure you don't have any infection, and send me the results of that. So, yep, run a CBC. Do you test everyone for whether IP6 will help or not? Yep, that's one of our standard things we test for. Do you have thoughts on ozone, especially home ozone units for daily rectal ozone? So daily rectal ozone insulation can be really good for a lot of things. You will absorb some of that ozone, and the ozone in your system can be beneficial for a lot of things. Now, we've had this discussion, 50 times on the Zoom call. And I know this is probably a new person asking this question. To me, ozone makes the most sense when you're trying to kill a pathogen, not when you're trying to kill cancer. So the ozone is O3. So that's what ozone is. So just understand the chemistry. So oxygen is O2. That's oxygen. It's a stable molecule. Oxygen has two electrons, and so it's stable when it's connected to each other like that. Ozone is O3. It's an unstable molecule. And because it's unstable, we can use it to our benefit. So it will search for something to attach to, and it attaches to pathogens. That's what ozone really in our environment. When you go out after a thunderstorm and you smell ozone and it smells so nice and fresh, really that is God's way of cleaning the atmosphere. So ozone is produced with lightning. So lightning produces ozone. The rain can pull ozone down from the ozone layer, and it kills pathogens. It helps kill mold in our environment in the environment of the world that you're walking in. It can be very beneficial for you. You could use an ozone machine in the air to help kill mold in your house. You can kill mold underneath your blankets. You can kill mold in a closet by putting the ozone machine in a closet. I recommend people put an ozone machine in a musty basement. I have an ozone machine in our office. I have an ozone machine in our house. My kids have ozone machines. Now, too much ozone can be damaging to the lung tissue. So all these machines have a setting on it so it won't produce too much ozone. So now there are some machines out there that don't have that setting. They're commercial use ozone machines, and you do have to be more careful with them because you could damage your lungs with too much ozone. Now, doing ozone the way this person is saying and using rectal ozone and using IV ozone, well, what would that be used for? It kills pathogens. So if you have Lyme disease, if you have chronic mold, ozone can be beneficial for that. Ozone will stimulate an inflammatory reaction too, so you could actually inject ozone into a degenerative knee, and that can be beneficial for that. But to kill cancer with ozone, I just don't know about that. There's just not any data that shows that it's going to kill a cancer cell. It doesn't kill your living cells. I don't know how the mechanism, how it's going to kill your cancer cell. So it's, adding an oxygen, a reactive oxygen species to the tissue can actually cause cancer. So using too much ozone internally, now, you won't absorb ozone if you're just breathing in ozone from an ozone machine. So you're not getting internal O3 that's breaking apart. It's and giving a reactive oxygen species. So a reactive oxygen species is cancer causing. That is an oxidative reaction, and that can cause cancer. So there's a difference between an oxidative reaction and oxygen. So so a reactive oxygen species, ROS, is damaging to your cells. So I don't see the benefit of using ozone personally, and I'm not against somebody who feels led to really you do ozone to kill cancer and they feel like they've gotten results from that. So I'm not making a judgment call that way. I'm just giving you my opinion. Yeah, I see ozone used. I see the success of ozone used from a clinical standpoint if you're trying to kill pathogens. I'm currently doing a month of focused naturopathic cancer therapies, 5 days a week, 9 to 4, such as IV vitamin C with ozone. There you go again. HBOT, infrared saunas, Beamer, which is PEMF. That's a low Gauss PEMF, Rife, and attempting to get more consistent into ketosis while taking supplements and weekend coffee enemas. After having a full body MRI in January, I'm sensing it's time to get a PET scan when I return to the cities in order to see what is active versus dormant. So first of all, I want to make a comment about doing this. You're doing all these things. These are great, and these can really help with detoxification pathways and all that kind of stuff. After doing a full body MRI in January, it's sensing to get a PET scan and return to the cities in order to see what is active versus dormant. I had intended to get one back in December, but decided against it. However, I have a bottle of supplement you recommended to help get rid of the radioactive stuff. I think you're talking about the homeopath. Someone else suggested getting chelation IV immediately following a PET scan Any thoughts or on the chelation IV? Chelation IV, where I think that is beneficial, is if you have acute heavy metal toxicity, like you're exposed to arsenic or aluminum or mercury. Chelation IV has a lot of downsides. So you're putting a heavy chelator right into your blood vessels to pull stuff out of the tissue. I mean, right away you have to, your bells and whistles should go off, because you are going to be pulling stuff out of the tissue way faster than your liver phase 1, phase 2, phase 3 pathways are going to be able to get rid of it, and all you're going to do is circulate it around your body. Now in a crisis mode where this person has been exposed to a high amount of heavy metals and they're poisoned, that's where you just got to do it. But in a situation like this, no, I would not say doing, radiation, the amount of radiation that's in a PET scan does not warrant IV chelation therapy. You could make yourself a lot sicker by doing that. What do you know about Sandra Rose Michael, who developed EES? And do you think EES what do you think of it as a Christian? How is it the same or different than Rife? Are there any benefits from this? I searched our member site and didn't come up with anything there. Yeah, because I'm not familiar with it. I did look it up, and I can't really comment on it because I'm not familiar enough with it. I don't know if it's a machine that they're using or it's a technique that they're using. I just don't know enough. So I want to give you misinformation. Okay, just got my results back from the cheek swab. You suggested taking AromaClear. Is it okay for me to take it? And I'm on anastrozole, which is a hormone blocker. Yes, yeah, you can take that right along with it. I struggled to enter the Zoom questions this week. My question would show sent each time I tried it. Second question immediately. That's okay. We did get your question about 3 times. That's all right. I've never been on that side to see what it says, but yeah, we did get it. And if you it's no harm if we got it twice. So can you explain the benefits of Clear PC? So Clear PC is PC stands for phytocannabinoid. So what is a phytocannabinoid? It's CBD. So what's the benefits of CBD? Oh boy, gosh, how much time do we have? CBD has huge benefits, just like any other nutrient. So you have endocannabinoid receptors on every cell membrane, and it can decrease inflammation. It can help calm. It can decrease glutamates. There's just tons and tons of benefits of CBD. In one sense, it can be a cancer killer. So CBD is different than THC. THC is typically from marijuana, and it gives you a totally different effect. CBD is typically from hemp. Everything we sell is hemp-derived CBD. Pretty much everything on the market is hemp-derived CBD, because there's just so much more CBD in hemp than there is in marijuana. It's so much cheaper to grow, and it's legal. So Avamar granulate has been added to my protocol. I see that it is fermented for my diet. No fermented foods were directed. Yeah, but this is a dried fermented wheat germ oil, and it's a cancer killer. So definitely this is something you need to take. The one who wrote about urination urgency is 54. So again, I would definitely get a CBC done for sure. So would you recommend D-mannose for UTI symptoms? Yes. So there's really not any downside for D-mannose. It's something, again, you wouldn't necessarily take all the time. You'd take it only based upon symptoms. You'd take it like a medication, then feel like you have a UTI, then you take that. Also, I didn't mention, you guys are probably already doing that, but make sure you're running your RIFE program for UTI and things like that if you are suspecting anything. So there's a bunch of urinary tract infection programs and different bacterial programs and different viral programs and COVID programs. So make sure you're looking through your Rife because you can use those. Use your Rife. That should be your first go-to. Since the coffee can take a varying amounts of time to be ingested, at which time the 15-minute timer should start, might the toxins get reabsorbed if it goes too long? Same with a detox foot bath. So I think you're talking about doing a coffee enema for longer than 15 minutes. I'm not sure I'm understanding your question completely. So so if you're doing a coffee enema and it's taking more than 15 minutes, no. So coffee enema is stimulating the vagus nerve down at the rectal area and thereby stimulating phase 1, phase 2 pathway in your liver. Also stimulating your parasympathetic stimulates your immune system. So it's not, I would worry about reabsorbing toxins if you're doing everything else that you should be doing too, and you're having good bowel movements. Do you suggest the AMOS test? Remind me what the AMOS test is. I'm going to blank here. Oh, that's the anti-malignant test. Boy, I'm not familiar enough with that test to say to use that. We've never used that test. I've never done any research on that test, so I don't know if that would be a good test. We typically recommend people to get tumor markers run. Now, then they're stuck if they don't show any tumor markers, so they can't use tumor markers to kind of guide, whether they're doing better or not. But even if your tumor marker tests are all within normal limits, you still can use those as a marker. They're markers. So like any blood test as a marker tells you that something might be going on, and then you do further diagnostic testing to see what that something might be. Tumor markers are inexpensive. I think our female tumor marker profiles are like $100. It's something that you could do on a monthly basis, most people. It's also covered by insurance if your doctor recommends it and orders the test too. Standard tests. I have tinnitus and been taking an Anno E300. I know there's a Rife program, but it's 8 hours. Should I just run a couple hours during the day? Will it help if I never get through the entire program? Of course, I'm running my cancer programs. Yeah, so if there's a program that you want to run on the Rife that's too long, just running any time on that program can be helpful. Tinnitus is a difficult thing to treat. Now, I recommend the Delta tocotrienol. That's what's in the Anano E300 or our APOP-E is the same thing. But tinnitus is, so remember the inner ears, there are certain parts of your body that you have what are called terminal vascularization, meaning that you don't have anastomosing vessels, meaning that you don't have other vessels that feed the area if a vessel gets constricted or blocked. So in your heart, you have terminal vessels. In your ear, you have terminal vessels. And your vascularization can be affected by a lot of different things. Infection, H. pylori, Lyme disease, heavy metal toxicity, sympathetic overdrive. Your sympathetic nervous system causes constriction of the vessels. That's what increases your blood pressure. And that can lead to a lack of oxygen to the auditory nerve. So the auditory nerve in your ear is innervated goes back to the temporal lobe. So if you have damage of the nerve back to the temporal lobe, chance of that regrowing is very, very difficult. Now, the benefit of taking delta tocotrienol for tinnitus or for your heart is because it helps open up those terminal vessels. So I've had people with tinnitus that have started with delta tocotrienol, and they've literally cured their tinnitus. I've had people with complete loss of hearing in one ear, and I put them on the delta tocotrienol, which is the inner part of the vitamin E molecule, and they got their hearing back completely. So, but I've also had people with tinnitus that I just couldn't budge ever, never did. It seemed like no matter what we did, it didn't help. Nothing helped. I do know that you have to look for inflammatory, other causes of inflammation with tinnitus too. So you do getting a Cyrex, Array 10 can be helpful for that. But again, there's some people, if you have damage all the way back to the temporal lobe, it's pretty hard to fix that. Now, there are some temporal lobe brain-based therapy exercises that you can do. And my wife actually has tinnitus, and she asked me to put some of those things together. So when I do, I will actually post it up on our member site for everybody, or I'll create a blog post about it. Have you ever heard of Ralph Moss's top 5 nutraceuticals for cancer, resveratrol and flavonoids, curcumin, sulforaphanes, and EGCG? Yeah, I actually interviewed Ralph on one of my podcasts a couple of years ago. So all of these things are good. So all these things I talk about on at least every other Zoom call, because these are all flavonoids that are anti-inflammatory. So these are so good for not just cancer, for everybody. But you got to remember with these things, especially resveratrol has the shortest half-life of just about any nutrient that you can consume. So you have to break it up into doses. And it's sometimes hard for you to do. It's hard for me to do. Maybe it's easy for you because you're more disciplined and you take your supplements morning, noon, and nighttime. But resveratrol, above anything else, you got to break it up throughout the day. And also remember EGCG, which is the catechin from green tea extract, is the most polluted nutrient on the market, period, exclamation point. All green tea extract, all of it, all EGCG comes from China. So you have to have a really good, clean source of EGCG. And if you went and bought EGCG green tea extract at any store out there, you're going to get just crap stuff that's polluted. My favorite is the TV Go from US Enzymes, because they are anal about their purity. So are some other good companies. They're really anal about their purity. They check it, and they buy only from good, clean sources. So can I eat flax instead of the soy isoflavonoids? Yes, you can. You don't want the soy. Flaxseed, but there's other flavonoids in other things. So quercetin is another good one too. Too much flax is going to be too much omega-6. Remember that too. So you want to keep a good omega-3 to omega-6 to omega-9 balance. Those are your fats that you're consuming. And too much flaxseed is going to be very high in omega-6, which is going to be pro-inflammatory. So that's the benefit of olive oil. It's an omega-9. It's a anti-inflammatory. Omega-3s, fish oil, are also anti-inflammatory. Being on hormone blockers, is there any blood work or other tests I should ask my oncology for to keep an eye on? No, not really. If you want to know your hormone level, the best test to do is the Dutch test, DUTCH, and you can order that through Rupa Labs. But you really don't need to run it, because if you're on hormone blockers, your bad estrogen, all your estrogen is going to be in the cellar. So there's no need to spend the money on that test. Who would run that test? Somebody who just found out they have cancer, or and their doctor wants to put them on hormone blockers. And they don't want to go on it. They want to look at their hormone levels. I just ran a test for somebody and just went over it with them 2 days ago, and her bad estrogen, her 4-hydroxyestrone, was elevated, not good. Even though her E1, E2, and E3, those are your standard estrogens, were actually the low normal. For some reason, most likely a cytochrome P450 pathway was pushing it to be converted to the bad estrogen, which can drive cancers, hormone-related cancers. I'm having 1 PM in the AM, good consistency, and sometimes another later in the day. I do coffee enema every day, sometimes morning, sometimes PM. The only thing I'd say, be careful with PM, is it might keep you up if you're absorbing any of the caffeine. If it's not, then don't worry about it. Going through your detox course, more than 1 BM is preferred. If you're having 1 good BM, you feel like you're cleaning out, maybe an extra 1 during the day, I think you're just fine. Should I begin some magnesium? No, I wouldn't. I wouldn't. So if, it really depends if you feel like you're really cleaning your gut out, and it's not like, oh, I had a bowel movement, but I just feel like I have more in there and I'm not really cleaning myself out. Then yeah, go on some magnesium to help you. But if you feel like you're cleaning out, and sometimes you're having to, and you're doing a coffee enema and you're not having to expel any with that, or very little, then I'd say no, don't worry about that. I leaned over the center console in my car last week and hurt a rib. Hurts quite a lot, but I think it's broken. Is that this is new for me? Concerns? Um, yeah, I mean, even if you don't have cancer, you can break a rib. I can't tell you how many ribs I broke. I mean, I've broken every finger in each hand, some more than once, and broken, ankles um, and fibulas, and so and it had nothing to do with pathological fractures, and nothing to do with metastasis to the bone. You could break a rib doing something like that. You could sprain a rib doing something like that, and it could hurt just as bad and take longer to heal than a fractured rib. But always, you do want to consider, is it do I have a pathological fracture? Um, get an X-ray. That's not very much radiation. If you have a chiropractor that can take an X-ray for you, you can see if there's a break there. Really, there's nothing you can do for the broken rib itself. So if you didn't have cancer, I would tell you not to go get an X-ray, because there's not a whole lot you can do for it, except maybe use a rib belt to just let it heal. The problem is, every time you breathe, your intercostal muscles move that rib and it causes irritation. So ribs take a long time to heal. They just do, sprain or fracture. When you have cancer and something seemed to crack easily and you're concerned about it, then you're concerned about, do I have metastasis to the bone causing a weakness in that bone? And so that's when you might want to do an X-ray to see if there's a fracture, because then that might spark you to go and look if there's any metastasis to that bone. And why would you need to know that? Well, because it might spark you to look at any other possible bony metastasis, and might spark you to do some other form of treatment like radiation to a metastatic tumor to the bone, because that's always going to be lytic. It's always going to be bony destructive. But if you're like, hey, I'm not doing that anyhow, then don't do that. I've had people that hurt something, and then it's like, well, I can live with this, but should I look at it? And sometimes it's like, well, maybe it's God's way of showing you that there is metastasis there, so you can take care of it. So you don't want to just, quote unquote, man up on everything and suffer through something. Just pray about that, whether God's trying to show you something, or heck, there's times you fall down and maybe it's just me. But Sometimes I fall down and hurt myself, and it's just because I'm clumsy or because I'm working too hard. So it doesn't mean God's trying to always tell you something. It's sometimes he's trying to tell you to do things. At least for me, sometimes he's just telling me to slow down. So is the Prenuvo scan used acceptable in conventional care? Well, it's slowly becoming accepted, but not very quickly. It's not paid for by insurance still. So yeah, it takes a long time for standards of care to catch up with anything new. Unfortunately, standards of care are getting worse. I mean, people are like, okay, wait till they start covering alternative care. Yeah, not until we have a completely, change in, it's never going to happen. So maybe in the new heaven and the new earth, then you'll have coverage. But I think it says that we're going to be healed by the leaves of the trees and the plants that we eat. So we're not going to have a need for that. So sorry, I digress. No, I don't think it's really accepted by conventional care. There may be some conventional doctors that recommend it, but they would probably be in private practice because they would get fired if they recommended something outside of their system. That's where we are with conventional care. Doctors aren't doctors anymore. They're basically technicians. So, they recommend what they're supposed to recommend. They can't think outside the box. They can't think outside the system, or they will get in trouble. So the doctors are controlled by the hospital system. So yes, a Prenuvo is an MRI. So it's magnetic resonant imaging, and it does not use contrast dye. So that's the benefit of the Prenuvo. There's no contrast dye used, so you don't have any gadolinium, and it is MRI, so there's no radiation. All right, I think we'll end for the day. Thank you guys for being on. And know that I'm praying for you guys daily. I've been told that the MRI is the most harmful of them all. I don't know who told you that, but I would disagree with that. MRI doesn't give you any radiation. CT scan is probably the most harmful between the CT PET scan and MRI, because the CT scan gives you about the same rad dose of radiation as 50 chest x-rays. So of all the x-rays, the chest x-ray is the most radiation of any x-ray. And one CT scan is about 50 chest x-rays, rad dose. There's no radiation in MRI, but if you have gadolinium toxicity, well, that could be really bad, but you don't know if you have gadolinium toxicity unless you are exposed to gadolinium. So some people, but it's a very, very small amount. It's less than 1% of the people that have ever gotten an MRI got really sick with gadolinium toxicity. Now, if you got 10 MRIs, you could end up with overexposure to gadolinium, but you don't necessarily have a gadolinium sensitivity. All right. I will see you guys next week. Bye-bye.